Okay, so looking at transverse friction massage, and again, these other forms of massage can be worked into a Hoffa massage. It's just that they're much more commonly done on their own. So transverse friction is a non-gliding or shearing technique. So what you're essentially doing here is you're going perpendicular to the fibers and you're not gliding along the skin, but you're actually doing a deep pressure and vigorously going back and forth across the tissue in a perpendicular manner. So if you're looking at this picture here, basically what they're doing here with their fingers is vigorously rubbing back and forth. This would be somebody who is probably suffering from epicondylitis. What they're actually doing is taking their thumbs and vigorously rubbing back and forth, pushing in, not gliding over the skin, but pushing in and putting some deep pressure. Some of the benefits to transverse friction, one of the things is it can actually jumpstart inflammation. So in some of the conditions you would be treating that get to be chronic and persistent, they actually lack an inflammatory process and require an inflammatory process in order to heal. That's what you would be seeing here with something like an epicondylitis, where itis is actually a misnomer. Many times there's no inflammation, the tissue stuck in a degenerative state, and you need to basically kind of reboot that inflammation process in order to kind of get it to heal. So you're usually looking at treating, typically more persistent conditions, persistent slash chronic conditions. You can actually use this on ligament sprains as well to help remodel collagen. Doing this in these tendinopathies, it could help remodel collagen as well. It does help in reducing pain. Now, this is a massage that is a little uncomfortable to start, but many times what you actually find is that the patient will report that the pain gradually decreases over time. So the idea here is the level of pain control. This is a level 2 pain control mechanism where, again, because you're kind of introducing sort of an uncomfortable stimulus, that will sort of help in controlling their pain. So this is pain control through level 2. You also can get some reduced edema and spasm reduction because of just reducing some tightness in the tissue. So your indications for this are essentially decrease scar tissue in tendinitis and promote collagen alignment. And again, you would use this in chronic conditions, ligament sprains to facilitate healing. And you could also use it to treat trigger points. So your friction technique, essentially typically you're just going to go just transverse to the tissue. Circular technique you can use, but it tends to work better just finding, because most of the areas where you're going to perform this on, you're going to kind of do it along tissue going perpendicular to the way the fibers run. The pressure should be uncomfortable, so it should hurt. You would like to start with the muscle in a relaxed joint neutral position, but over time, you may want to induce some stretching with it. You definitely would like to follow this with stretching exercises, but once the patient gets used to having this done, you could then actually, put the muscle in a more stretched position and gradually work it, but at least start with it in a relaxed position. And you will not use lubricant with this. So you don't want to use lubricant with the friction massage, because if you do, your thumb or your finger is just going to glide along the skin and you're not going to actually promote any changes to the tissue. The timing for this is about a 5 to 15 minute treatment. Usually the idea here, what you would do is, what I tend to find is wait and see if the patient starts to complain of decreased discomfort. So once the patient has decreased discomfort, maybe go a little bit longer, but then at that point, you've kind of accomplished what you're doing with the technique. And usually that falls around 5 to 15 minutes. I've probably found that most of my treatments have been closer to the 5-minute side. And again, you could combine this with other modalities as you see fit. So again, use your evidence to determine what modalities you might want to precede your friction massage with. Contraindications: open wounds, fractures, skin conditions, hypersensitivity, and infection. Be aware that it may deter the patient. So again, it can be pretty painful, in these areas, particularly when you're doing it for a tendinopathy, over the patellar tendon, Achilles tendon. Again, over the lateral epicondyle by the extensor tendons for the wrist up in the forearm. It can be a little uncomfortable, but over time, a lot of times the patients kind of just adapt to it. But just be aware that anytime you do something that's potentially uncomfortable, it could be a deterrent for the patient. Bindage web massage is another type of massage that you can use to break up soft tissue and adhesions. And essentially what you do with bindage web massage is you use your fingers and you more or less do like typically more of a pinching and pulling of the skin and the soft tissue. So what you're literally doing is lifting this up. This works really well, particularly around surgical incisions. So if someone has a surgical incision, they could sometimes get some scar tissue underneath. Well, literally what you'll do to prevent that is you'll go in and you'll kind of lift the skin right around where the incision is and kind of pinch around there. You usually want to wait around 2 to 3 weeks after surgery because you want to make sure that some of that collagen is starting to get lying down so you don't disrupt the healing. And then you can become more aggressive after 6 weeks. But again, you could use different motions. Again, the only couple times I've used this type of massage, it's usually over surgical wounds, and I just do like a pinching pulling technique where I kind of lift. Essentially, you're lifting the skin away right around where the surgical wound is as it's healing, pulling it away from the subcutaneous tissue and the tissue underneath, because that could potentially end up affecting somebody's range of motion. So if someone, think about it, if your skin kind of scars down to the tissue underneath, it could end up impacting your motion. So you have to consider that, particularly if it seems like someone is going to produce a large amount of scar tissue. As far as contraindications, the same as the previous. So all the same contraindications we've been talking about for the other forms of massage. Now, you can use transverse friction for trigger points, but you can actually just use trigger point massage for it as well. So a trigger point is essentially a taut area in the soft tissue. So you could find trigger points in muscular tissue. You could, again, sometimes they'll be what are called latent trigger points, where unless you push on them, they won't really hurt. But trigger points can refer pain to other areas of the body. And a lot of times the patient will experience this. Now, sometimes people will have what are called trigger points, or they'll have what are called tender points. You're essentially treating them the same way. The difference between a trigger point and a tender point is a trigger point will refer pain many times. So when you push on it, the pain will kind of refer out from the area. A tender point, when you push on it, it'll hurt right over where the point is. You essentially treat both of them the same, and in both instances, usually what they are is they're just overactive areas in the tissue. So what you do with this essentially is you apply a deep pressure with a circular motion. Again, you could use your thumb, a knuckle, your elbow, okay, and basically just push into that. And what you're basically trying to do is by putting all that added pressure over that trigger point is you're basically overloading it and trying to get it to fatigue. So you're essentially trying to get it to give up. So it's there, it's all real tight. You're pushing into it to kind of basically overload it with stimuli to get it to release and relax. Pain relief here at level 2, again, much like you have with the transverse friction massage. So you get that level 2 pain relief. Again, you're kind of inducing an uncomfortable stimulus. But again, a lot of people do tend to like trigger point therapy because while it does cause pain, it does, again, that level 2 pain relief does tend to work really well. Contraindications, you have the same as the others that we have talked about. So those same contraindications as for transverse friction massage. Just a quick word about massage lubricants. Again, I mentioned these briefly. So really, the only massage that we have that you'd really use this is with the general Hoffa massage. The other forms of massage, you wouldn't want to use them for. I mean, trigger point, you might be able to, but you're still going to want to have pretty good contact with the tissue. Transverse friction massage, you definitely would not, because essentially you're going to be gliding over the skin. You're not going to be impacting any of the deeper tissue. You have some different types of lubricants, lotions, oils. You can use, some people like to mix in a little bit of the analgesic creams. Those are the you know, icy hots, biofreeze, those things, because they give a little bit of like a counter irritant effect. And there's various powders that can be utilized as well.